Polycystic ovary syndrome among Kashmiri women is above 30%, the highest across the globe according to the Indian Council of Medical Research. As per the ICMR National Task Force, the prevalence of polycystic ovary syndrome, or PCOS, among Kashmiri women is above 30% by Rotterdam criteria, which probably is the highest percentage globally.
Quoting the official figures, news agency KNO reported that Kashmiri women have 33.3% by Rotterdam criteria of PCOS. This means out of these three, anovulation, hyperandrogenism, or polycystic ovaries, two must be present on ultrasound of the woman with PCOS. The data further reveals that the prevalence of PCOS among Kashmiri women is 28.9% by the National Institute of Health criteria, which is the criteria earlier used to diagnose PCOS in women. The NIH criteria are based on hyperandrogenism and chronic anovulation, or on sonographic findings of polycystic ovaries in women. As per ICMR, 34.3% by androgen excess PCOS criteria of PCOS is prevalent in Kashmiri women. AE-PCOS criteria of PCOS is the presence of hyperandrogenism, clinical and/or biochemical, ovarian dysfunction, oligoanovulation, and/or polycystic ovaries, and the exclusion of related disorders in women with PCOS. ICMR National Task Force defines all the three criteria of PCOS present in Kashmiri women, probably the highest percentage globally. Pertinently, polycystic ovary syndrome, or PCOS, is a long-term, highly prevalent, complex endocrine disorder characterized by a multitude of metabolic and reproductive disorders. It affects 6 to 23% of reproductive age women globally, though the estimated frequency can rise up to 33% depending on the diagnostic criteria used.
Rising concern. PCOS surge among women in Jammu and Kashmir. Jammu and Kashmir, known for its breathtaking landscapes and rich cultural heritage, is facing an emerging health crisis that demands immediate attention. Polycystic ovary syndrome, or PCOS, also known as polycystic ovary disease, or PCOD, is rapidly gaining ground among women in the region, leaving a trail of physical and emotional distress. PCOD is characterized by a range of symptoms and can have a significant impact on a woman's reproductive health, as well as her overall well-being. As per the Indian Council of Medical Research National Task Force, the prevalence of polycystic ovary syndrome among Kashmiri women is above 30% by Rotterdam criteria, which probably is the highest percentage globally. The data further reveals that the prevalence of PCOS among Kashmiri women is 28.9% by the National Institute of Health criteria, which is the criteria earlier used to diagnose PCOS in women. In India, the prevalence is gradually increasing. According to a study conducted by researchers, PCOS are becoming epidemic in Bangalore city because of the lifestyle that people have adopted. Almost all foods are packed with chemicals that lead to hormonal imbalance. The etiology of PCOS is not completely understood, and there is no known cause. PCOS is associated with reproductive disorders and cardiovascular disturbances including insulin resistance, obesity, hypertension, diabetes, and dyslipidemia. Current evidence suggests that PCOS is a polygenic multifactorial disorder, and that its pathogenesis and clinical presentation are influenced by both environmental risk factors and genetic susceptibility. However, a causal genetic pathway has not been identified until the present moment. Among environmental factors, lifestyle aspects such as an inappropriate diet and sedentary behavior, which contribute to central adiposity and metabolic comorbidities, play an important role in the pathogenesis of PCOS. Awareness campaigns, both at the community and individual levels, are pivotal in combating PCOS. Educating women about the signs, symptoms, and potential health risks associated with the condition can encourage early detection and timely medical intervention. Additionally, efforts to train healthcare professionals and establish specialized clinics dedicated to PCOS management would contribute significantly to improving the situation. Furthermore, policymakers and the government need to recognize PCOS as a public health priority. Allocating resources and funding for research, diagnostic facilities, and affordable treatment options can alleviate the burden on affected women. Integrating PCOS management into existing public health programs would ensure that women in Jammu and Kashmir receive the necessary care and support. It is important for healthcare authorities, researchers and policymakers to recognize the significance of PCOS as a public health issue and prioritize data collection and research efforts to better understand its impact on women's health in Kashmir. By conducting thorough studies, it will be possible to develop more effective strategies for prevention, diagnosis and management of PCOS in the region.
Symptoms of PCOS. PCOS manifests in various ways, and its symptoms can vary from person to person. Some of the common signs and symptoms of PCOS include irregular menstrual cycles. Women with PCOS often experience irregular periods, which may be infrequent, heavy, or prolonged. Excessive hair growth, also known as hirsutism, is another common symptom of PCOS. Women may notice increased hair growth on the face, chest, back, or other areas typically associated with male pattern hair growth. This condition, along with acne and oily skin, occurs due to elevated levels of androgen hormones. PCOS disturbs the normal hormonal balance in the body, leading to an excess of androgens, such as testosterone. This hormonal imbalance can result in acne, excessive hair growth, and male pattern baldness. Ovarian cysts. PCOS is characterized by the presence of multiple small cysts on the ovaries. These cysts are formed when the follicles, which are responsible for releasing eggs, fail to mature and release eggs properly. Weight gain. Many women with PCOS struggle with weight gain or find it difficult to lose weight. This is partly due to insulin resistance, a common feature of PCOS, which affects the body's ability to regulate blood sugar levels. Fertility issues. PCOS is one of the leading causes of female infertility. The hormonal imbalances and irregular ovulation associated with PCOS can make it challenging to conceive. Skin issues, including acne and oily skin, are common manifestations of PCOS. Hormonal imbalances stimulate sebaceous glands, leading to excessive oil production and clogged pores. Persistent acne outbreaks can significantly impact self-esteem and confidence, underscoring the importance of recognizing these symptoms as potential indicators of PCOS.
Causes of PCOS. The exact cause of PCOS is not yet fully understood. However, several factors contribute to its development. Hormonal imbalance. PCOS is primarily characterized by an imbalance in hormone levels, particularly elevated androgen levels. This imbalance disrupts the normal functioning of the ovaries. Insulin resistance. Insulin resistance occurs when cells become less responsive to the effect of insulin, leading to high levels of insulin in the blood. Insulin resistance is commonly associated with PCOS and can contribute to the development of the disorder. Genetic disorder. There is evidence to support that certain genetic factors may predispose some women to develop PCOS. If a close family member has PCOS, the risk of developing the condition may be higher. Lifestyle factors. Unhealthy lifestyle choices such as poor diet, lack of exercise can also contribute to the development and exacerbation of PCOS symptoms. Chronic stress. It has been suggested as a potential contributor to PCOS. Stress triggers the release of stress hormones like cortisol, which can disrupt the delicate balance of reproductive hormones and exacerbate the symptoms of PCOS. Additionally, stress can lead to unhealthy lifestyle habits such as emotional eating and disrupted sleep patterns, further impacting overall health.
Treatment options for PCOD. While there is no cure for PCOD, the symptoms can be managed effectively. Treatment options focus on addressing the underlying hormonal imbalances and associated symptoms. The following are commonly used approaches. Lifestyle changes. For many women with PCODs, making positive changes in their lifestyle can have a significant impact on their overall well-being. Regular exercise, such as aerobic activities and strength training, can help improve insulin sensitivity, manage weight, and reduce the severity of PCOD symptoms. A balanced and nutritious diet that focuses on whole foods, including fruits, vegetables, lean proteins, and whole grains, can also contribute to hormonal balance and weight management. Oral contraceptives. Hormonal contraceptives, such as birth control pills, may be prescribed to regulate menstrual cycles and reduce androgen levels. Anti-androgen medications can help control excess hair growth and acne. In some cases, insulin-sensitizing medications like metformin may be prescribed to manage insulin resistance. Anti-androgen medications. In cases where excessive hair growth or hirsutism or severe acne is a primary concern, anti-androgen medications may be prescribed. These medications work by blocking the effects of androgens such as testosterone, reducing the symptoms associated with excess androgen production. However, it is important to note that these medications may have potential side effects, and regular monitoring by a healthcare professional is necessary. Metformin, a medication commonly used to manage type 2 diabetes, is also prescribed for women with PCODs, particularly those who have insulin resistance. Metformin helps improve insulin sensitivity, regulate menstrual cycles, and reduce the risk of developing complications associated with PCODs. However, its use should be guided by a healthcare professional, considering individual factors and medical history. Surgical intervention. In rare cases, when medication and lifestyle changes are ineffective, a surgical procedure called ovarian drilling may be performed to stimulate ovulation by removing a small portion of the ovarian tissue.
Spreading awareness on PCOS and promoting early detection. Educational campaigns. Public awareness campaigns play a vital role in disseminating information about PCOS. Collaborations between healthcare organizations, educational institutions, and community centers can facilitate workshops, seminars, and awareness programs. These initiatives can educate women about PCOS, its symptoms, and the importance of early diagnosis and treatment. Women's health clinics. Establishing specialized women's health clinics or enhancing existing gynecological departments can contribute significantly to PCOS awareness and management. These clinics can offer comprehensive care, including screenings, consultations, and treatment options for PCOS. Additionally, they can provide educational materials, brochures, and pamphlets to raise awareness among patients. Community engagement. Engaging local community leaders, women's organizations, and influencers can help spread awareness about PCOS in Jammu and Kashmir. Through community gatherings, social media campaigns, and interactive sessions, the message about PCOS can reach a wider audience. It is essential to address cultural beliefs, misconceptions, and stigmas associated with women's health issues, fostering an open dialogue for better understanding and acceptance. Collaboration with schools and colleges. Collaborating with educational institutions is a valuable approach to reach young women and girls who are at risk of developing PCOS. Conducting awareness sessions as well as health camps and distributing educational materials in schools and colleges can provide crucial information about PCOS, its impact on health, and the importance of adopting a healthy lifestyle. Many women have PCOS but do not know it, and it cannot be diagnosed only through ultrasound. Among other symptoms, the women suffering with PCOS also have thinning of hair, acne, hard and unnecessary hair on the face and body. Dr. Doro Shah, president of PCOS Society, said that although this disease is not new, it is becoming more common among women due to lifestyle changes. Like the rest of the country, women are also suffering from PCOS in Kashmir Valley as well, with 15 to 20 patients being seen in OPDs of the hospitals on a daily basis. Dr. Sabahat Rasool, convener of PCOS Society India, said that due to the lack of complete information about this disease, many women are left without treatment, even as many women die due to lack of proper treatment. She said that the complete treatment of this disease has not been possible yet. However, this disease can be avoided by taking precautions and changing the lifestyle, Dr. Sabahat said. Former director of SKIMS Sura, Dr. Abdul Hamid Zargar, well-known endocrinologist of the Valley Dr. Muhammad Hayat, senior dermatologist Dr. Imran Majid, gynecologist Dr. Masuma Rizvi, Dr. Farha Nabi, and Dr. Sudha Sharma participated at the event.
Diet to treat PCOS. While many lifestyle recommendations are suggested for those women suffering from PCOS, you're encouraged to follow a PCOS diet with low fat and carbohydrate content. This would prevent any sudden upsurge in your blood sugar levels and help you keep a check on your weight. Foods that may be included are natural, unprocessed food, spinach, kale, and other leafy vegetables, foods high in fibre, broccoli and cauliflower, nuts and legumes, fish and whole grain. Exercises for PCOD. What exercises are best for PCOD? If you are suffering from PCOD, then your first task is to reduce your body mass index, or BMI. Various types of exercises that you could consider are high-intensity interval training or HIIT cardiovascular workouts, mind-body exercises, strength training and interval training. There is no clear cause for PCOD. However, early detection or diagnosis of PCOD will be constructive in relieving the symptoms as well as to reduce the complications involved. PCOD treatment helps you to manage your concerns, including infertility, hirsutism, acne, immature follicles, or obesity. However, specific treatment might involve lifestyle changes or medication.